are now at the end of the GYNOCARE meeting in Sofia, and I have next to me Professor Emiel Rutgers. We learned a lot about breast cancer in the last days, about the sentinel node that is standard practice in the Netherlands. And I want to ask you a question that actually patients have asked me. So what if we have a case of early breast cancer, mastectomy, and positive sentinel lymph node? What is the field of irradiation in these ladies? Because according to Amaros, we can choose between axillary surgery and radiotherapy. Maybe nowadays in Netherlands we go for radiotherapy more. So what is the field? Does the field include the only axilla or also the breast?
We feel that if there is an indication for radiation therapy after mastectomy due to the involvement of lymph nodes, there's also in general an indication for chest wall irradiation. And it's quite logical because the breast cancer cells coming from the primary tumor are migrating to the lymph nodes largely through the subcutaneous lymphatic plexus. So indeed this patient is not very high, but is at risk for lymphatic outgrowth of recurrence. So indeed you can diminish that by half by chest wall radiation therapy. And most studies done in this respect included the chest wall irradiation and the regional nodal irradiation. I think you should really consider that in this situation for this woman.
Thank you. And I have only one more question, because here in Bulgaria we don't really have access to genetic test tips, neither MammaPrint or Oncotype. They're very expensive, and actually the companies even don't have interest to come and offer it to the patients. But still, some of our patients are treated in Turkey, so they have information there for Oncotype, and they somehow want to do it here. How much is reduced the rate of chemotherapy after you're introducing MammaPrint in your institution?
Well, it's about by 30% for those women who have an indication for doing the MammaPrint. And this is in general over 45 years of age, stage 1, 2, node positives as well, HER2, ER positive, endocrine sensitive cancers, where you doubt on the indication for chemotherapy. In general, node positives, there is no much doubt, but here we do MammaPrint, and if it's low risk, over 50, we advise the patient not to do chemotherapy and adequate anti-endocrine, anti-estrogen treatment. And I know we reduce the indication for chemotherapy by 30, even 40% for this group of women.
Yes.
Yeah. About the availability, yes, that's an issue, but it is possible to order the test through internet. It can be done on FFPE. You don't need frozen. You can do it on FFPE tissues. So you can do it later on.
So thank you very much for your participation, that you came to Sofia. I hope you like it, and I really hope you join a next cost action and maybe come again, because you missed some things to see. So I hope next time you have the chance.
I am certainly inclining to be of service and of help for an upcoming event. And we fell a little bit in love with Sofia. There is mixed reasons I will not expand on, but what we have seen, it's very nice. And thank you for all the friendliness and hospitality.